the second annual Drug and Violence Awareness Expo. It is designed to create an awareness of what is going on in the county and provide our community with information where there's help and services so we can help fight this problem. We reached out to all the Carroll County Public Schools middle and high school students to invite them to come out today. We actually had 14 busloads of students come. Some of them for the first time. Oklahoma Road Middle School brought 8 school buses full of 8th graders to the event. Shiloh Middle School had brought 1 bus last year. They were back with 2 buses this year. We had some new schools that came from Francis Scott Key, Century High School, were just a few of the others. We probably had close to 550, 600 kids here today. If you're interested in being a part of the expo, we're looking for vendors to come out that have information, the nonprofits, any of those. Your booth is free. If you're a business that has services that ties in with this, we charge a very small fee for you to participate. We have some of those this year, and we're looking for that to grow. We encourage you to come out and visit the expo to learn about what is available for you. We have the Chamber's a nonprofit, so this event, we try to promote it to our members. We get sponsorships. There's all kinds of sponsorship opportunities, whether it's sponsoring a bus, being the major sponsor. So we're always looking to improve, so there's ways there. If you know of someone that can speak, be one of our speakers at the program that you could suggest to us, call the Chamber office. You can speak with me or anyone at the Chamber office, and our number is 410-848-9050.
Hi, good afternoon. I'm Major Richard Hart with the Carroll County Sheriff's Office. I'm the commander of the Operations Bureau for the Sheriff's Office. We're here today with the Drug and Alcohol Expo. We have a variety of our equipment set up here, our set team vehicles, our canine vehicles, some of our CRT units, and our mobile command post. We'll be out here all day letting everybody come and see what our equipment is and how we use it daily. They can walk through all the equipment, they can put their hands on the equipment. It's very important. We've had a lot of school kids come from Carroll County schools. Very important that they've got a chance to walk around and see exactly what we do and see the other booths and talk about drug awareness and alcohol awareness. It's very important, especially with our heroin and opiate epidemic. We got to get to these kids right away, and this is a perfect start.
Hi, I'm Samantha. I am here with the Maddie's House and the Tim Weber's House. They are sober living homes. I am myself living in the Maddie House. It's a good house with 9 other women. We do this for recovering addicts. I am myself a recovering addict. And so far, it's so good. You know, it's been helping everybody. It seems to help a lot of people. When you're ready, you're ready. A lot of people in addiction, if they have some type of drug addiction, will go to rehab or can contact any health department and just tell them that they want to get into either a detox or a halfway house. And there's so many of them out there. Westminster, sadly, is kind of small with halfway houses, but they're all around, and they can definitely get somebody in one. Just know that it's never too late. It's never easy either. But once you get through it, you know you'll get through it. There's all different types of drugs. I myself was a heroin addict, so I had to go through the withdrawal. And it was hard, but you know, like I said, once you get through it, you get through it. My life today is beautiful. I have great friends. I have a good program. I do have a sponsor. I work, the 12 steps. I can talk to any of the women in my house. It's like one big family. And you just become grateful. Like, you're miserable when you're out there using. So, you can definitely change your life before it's too late. Before it's too late.
So, these are high school kids, just like you guys, who made decisions and made choices that changed everything, not only for themselves, but for their entire families. So I went to pharmacy school with one goal. I wanted to help patients on their path to better health. I wanted them to be able to take medications that would really drive outcomes, right? We call outcomes. If someone is a diabetic, we want to give them medication to help them be healthy. That's what I went to school for. And yes, sometimes we do have, like many of you mentioned or noticed, we do have injuries and surgeries that require us to have short-term medications to help us get through the pain. I would hate to know that some of the medications that I dispensed out of my pharmacy actually caused the death of someone, as we just saw, every 19 minutes, right? Where do those medications come from? Out of my hands, into the right people, but unfortunately things happen where they get into the hands of people who are misusing them. So the first person that I'm going to mention is over here. All right, the gentleman on the side. So he is a football player, right? He was an awesome football player. He was a senior in high school. It was the year of his dreams. And what happened? What do you think happened? He made some bad decisions. He made some bad choices. He spent some time with the wrong crowd. He was a football star. He was on honor roll. And unfortunately, one night he spent a little bit too much time partying. And unfortunately, he lost his life to an opioid, to misusing opioids. He left behind a brother who looked up to him. How many people in here have a brother or a sister that look up to them or that you look up to? I know I do. I have a little sister and a little brother. This could affect any of us, and we could be leaving behind one of our siblings if we went down this road and we made some poor choices. The next person I'm going to talk about right here, his name is Nacho, right? He's a great kid. Same thing. He was a football athlete. He was a football star. He tore his, what is this, like ACL right on your knee? He tore his ACL. He had to get surgery. What do you think they prescribed him when he had surgery? An opioid. He had Percocet, Oxycontin. So he started taking a couple, and he got through the pain. He was doing pretty good. And then he took a couple more. And then he found out in school that if he gave one to one of his buddies, he could get some money for it. So then he started sharing his medication with some of his friends in school. Is that a good friend? I know I'm asking some pretty silly questions, but you guys, this happens and it's real. So Nacho's parents were both on the PTA, right? They were both actively involved in school. They had no idea any of this was going on. When they found out, what do you think they did? Do you think they ignored it? No, he came from a really nice family, a really strong family who wanted to make sure that he got better. So Nacho's story is a good story. He changed his life. He made some poor choices, but he had support from friends, from family, that helped him make some of the right decisions in his life. We got the same situation right here. So this young lady, same idea. Guess what her parents did when they found out that she was abusing drugs? They had her arrested. She was 17 years old and she spent her first night in jail. It's pretty impactful, right? To go in and to be in the same cell as someone who maybe took someone else's life, someone who's selling illicit drugs out on the street, your heroin and things that you mentioned before. She was able to turn her life around, but guess how long it took? I heard a couple weeks. I heard a couple months. Did I hear a couple years? Maybe not 50, but maybe a couple years. So these choices that you're making, you guys, can influence what happens for the next 2, even 3 years. So this is the biggest one that I want to talk about. Has anyone heard of Aaron before? So Aaron's the guy right here. So I got an opportunity to meet Aaron's mom, and I know that you just had a presentation where you got to hear some stories as well. But this one was pretty amazing to me. So this was, again, good kid, football star, graduated, came back, got to spend some time with his friends when he came back from college. They found out that maybe they were partying a little bit too hard. Went over to a buddy's house, spent the night on the couch. In the morning, he was supposed to meet his mom. It was Mother's Day. They were supposed to meet the mom at IHOP. Well, he never showed up. on the other side, what was happening is that, he was at the friend's house. The friend's parents came in and they said, why isn't Aaron waking up? Is he okay? He's like, oh yeah, we just partied really hard last night. We had a good time. Well, then they looked a little bit closer and his lips were blue. What happens when your lips are blue? You're not breathing very well, right? You're not getting oxygen to your body. So it took a little bit longer, but they finally were able to realize that he wasn't going to wake up. What do you think they did? No, they didn't call an ambulance. They threw some ice on him. Hopefully that'll wake him up. Finally, they poured him into the car, didn't even call mom and dad, so mom and dad still didn't know what was going on, brought him in an ambulance, brought him in the car, brought him to the hospital. A couple hours later, mom got the phone call while they were just finishing up at IHOP to say, hey, Aaron's at the hospital. It looks like he's been addicted to OxyContin for a long time. He took OxyContin 80 milligrams, which is some pretty heavy-duty painkillers. So we're gonna see a couple pictures in a little bit, but I will tell you that Aaron's mom watched him have 2 heart attacks. She watched him in a coma. How do you think she felt? Awful. That's her baby, right? How would you feel if this was your brother or your sister? It wouldn't be very good, right? This is a terrible situation because of one bad choice. So that's Aaron's story. I will tell you that he did wake up from his coma, but he was never the same again. So he spends every day, his dad shaves his face because he can't shave his face. His arms don't work the way they used to. He can't speak. He holds up 1 finger for yes and 2 fingers for no. That's how he responds to people. So what he does is him and his mom, they do go all across the country and they talk to students and they talk to parents just like you guys, and they tell their story about what happened because of one poor choice. And they ask, if you had the chance to do it again, would you take prescription drugs? What fingers do you think he holds up? No. Right? Okay. So I know this is some pretty heavy stuff from our middle and high school students, but the biggest thing I want you to take away, you guys, is that this is something that can change your life forever. Okay? 15 minutes? Okay. Does anyone have any questions so far? Is everyone awake in the back? Can you hear me at all? Am I doing okay? A little bit? Awesome. Very good. So notice the piece at the top, right? Our community, our responsibility. How many of you are actively involved in some type of volunteerism? You volunteer for something. What do? Boy Scouts, Girl Scouts, animal shelter? Awesome. Church? Perfect. What else? Scream it out, holler it. Science fairs? What else? What do we volunteer for? The library. Excellent. Perfect. All of these people that you come in contact with, you have the opportunity to influence in one way or another. So we're going to talk about that, but I want you to remember this is your responsibility and my responsibility. I live in Westminster. I live 5 miles from here. This is my hometown, and that's why I'm so passionate about coming out and speaking to you guys about those prescriptions that are sitting in your parents' prescription cabinets, okay? So, when I think about prescription drug abuse, and I think about the epidemic that's currently in our communities, I think about our community and our responsibility and how it's our responsibility to make sure that we're talking about this, that we're informing, that we're educating, and we're explaining the dangers that are associated with these types of medications. But ultimately, it's important that we're able to show you how one poor choice can lead to consequences that you can't change. Once you cross this road, you can't take it back. There might be the opportunity for you to have a different life, but there's no going back once we make some of these changes.
Hi, I'm Kate Schultz. I'm an information and referral specialist with 211 Maryland United Way Helpline. We're a free 24-hour information and referral service for all different sorts of health and human service resources. And so we're here today to help to, discuss with people the resources that are available in their community, to help with all sorts of different things, from help with different bills to housing, food concerns, healthcare services, all sorts of things. So that's what we're here for. So people can dial 211 24 hours a day to reach us. We also have a website, which is www.211md.org, and all of our resources are on there too.
Hi, I'm Tammy Lofink,
I'm Tracy Coons.
and we are the founders of Rising Above Addiction. My son passed away on September 14, 2014. Tracy's son Ryan and my son Rob were best friends. We wanted to do something that would make a difference and help us to heal, so we started a fund called Rising Above Addiction, and we raise money through different fundraisers, and we send young adults to detox.
We have a race, a 5-mile race coming up on Saturday, June 11th. It's a 2-loop course, so if you're not a runner, you can walk 2.5 miles. We are doing a skydiving jump in September. The date will be set. You can go to our website, www.risingaboveaddiction.com, for more information about how to get in touch with us if we can help in any way. Our fundraisers or to donate, we take donations all the time. As Tammy said, we've sent 9 young adults to detox. My son is in recovery, 16 weeks clean. So, anything else?
Come out and join us and do our running for recovery, or in September you can do our annual skydive jump, or you can just donate to our fund.
Hi, I'm Lisa Pollard,
And I'm Rick Pauley.
and we're with the Carroll County Health Department and Access Carroll, and we're here to educate the community about the Operation Save a Life program that we have, where we teach lay people how to recognize and respond to an opioid overdose using either nasal naloxone or the EpiPen version of naloxone if their loved one experiences an overdose from heroin or other prescription opiates. We do the training the third Wednesday of every month at Access Carroll, and people can call the health department at 410-876-4800 to register for the class. The class is from 5:30 to 7:30. It's free of charge, and you will either leave with a kit with the nasal naloxone, or depending on your insurance, you could also be prescribed the EpiPen version.
All right, I'm Barbara White with the Carroll County Health Department, and I'm here today with the Tobacco Use Prevention Program. Our goal is to to prevent youth from starting to use tobacco products, really any product that has nicotine in it, whether it's cigars, cigarettes, vapor products. We don't want them to start because they'll become addicted, so we have lots of information about prevention and the dangers of these products. I can be reached at the Carroll County Health Department at 410-876-4443. And Carroll County Health Department also has a new Facebook page, so like us on Facebook.
Hi, I'm Debbie with PAD, Positive Alternatives to Dangerous and Destructive Decisions. I'm a registered nurse. I worked at the Trauma Center for many years, almost 30. And I have a program where we are in the community talking about injury prevention. So right now, this time of year, I am doing Prom Promise. Tomorrow I'm speaking at a school in Montgomery County. I've been doing schools in Baltimore County this year and all around. And then we're doing a class for offenders, people who are speeding or drinking and driving and have pre-court sentencing that they'd like to say to the judge, look, I'm trying, I'm learning something. We'll be offering that here in Carroll County as well. Registration is done on pad.org, and that's PADDD.org. And again, I work as a nurse, but I also work with some judges, some lawyers. I have law enforcement that works with me, as well as people that have been injured due to drunk driving or texting injuries and that sort of thing. So we try to make it real to people as to why they need to buy into safe driving practices, because it affects all of us.
Well, good evening and welcome. I want to first say, really thank the Chamber of Commerce. The fact that they partner to do this kind of event and really put on such a great event to bring out so much of the community to come out and help deal with the issues and the challenges we have, from domestic violence to drug abuse, to child abuse, sexual assault, to be able to have this all-in-one, one-stop shop for information is really tremendous. And I will tell you, for all of you that weren't here earlier today, there were hundreds of school children that were able to come out here today and to get a tremendous amount of information. And we owe that to the Chamber of Commerce. It really did just a tremendous job with that. I can tell you that, and I've said this before, and I still have never been paid for it, but Mike Mullen, as the president of the Chamber, does an absolute fantastic job as a chamber president. Having dealt with a lot of chambers before around the area, I can tell you it's a tremendous thing that he puts on with the chamber. And Joe Tabling, I don't know where you are, you Frank the who does, who really was an inspiration for this, really is the drive behind what we do at this expo, and I just can't thank them enough. So I at least want to make sure we give them a round of applause. And with that, I'm going to invite up our chamber president, Mike McMullen.
Thank you, Brian. Can everybody hear this in the back? He's thanking me now, but when things didn't work, he was like, if the chamber could just buy a decent sound system. No, but this has been a really great day, and thank you for the nice, kind words. But to be honest, I had almost nothing to do with this event, except to say, okay, go with it, after Joe last year said he wanted to do it, and I said, it's probably going to be too big for us to handle. But I want to give a special thanks to Mr. Joe Tabling. Joe, are you in the back there anywhere? Joe's here somewhere. He's been just doing a phenomenal job of this. And I'd like you guys to give him, please, a round of applause. And another person who deserves a big round of applause is Ms. Peggy Soper from my office. She did a phenomenal job, and she talked to probably almost every one of you. So please give her a round of applause, too. Thank you. Yeah, Peggy. I'd like to also thank all of our officials for being here with us. You know, we can't do these things without that type of an actual partnership. And this has really been a great event, and I think we've already booked this in for next year as well. I'd like to also say that there's no chance we can do this without our sponsors. And we had quite a few, but the main one that we had was Carroll Hospital. And we have here from the hospital Miss Sharon Sanders, who's the Vice President of Clinical Integration. Give her a round of applause, please.
So I want to thank everyone for being here and everyone's hard work in the community on drug and violence awareness. Carroll Hospital is very proud to be a sponsor of this event. It is such an important issue in our community. Over the last year, Carroll Hospital has done many things to try and work on taking opiates out of our homes. We are working with our physicians in our emergency department, not prescribing opiates. We are looking at a Dilaudid-free emergency department. Of course, I see our nurses. We have our terrific sexual assault forensic examiners program, and we're also working a lot with our county partners on the distribution of naloxone in our community, because we think that's a very important thing in our community. So we're going to continue to work with all of our wonderful partners. It takes a team, and I thank everyone for being here and doing your part in raising awareness for this very important issue.
I want to, at this time, recognize some of the different people that we have here, because part of this is not only this expo, but it's to highlight a lot of the things that are being done year-round since we did the first expo last year. And I want to recognize some of the law enforcement people that we have here. Sheriff Jim DeWeese, Sykesville Police Chief Mike Spaulding, Westminster Police Chief and no relation, Jeff Spalding.
Good brothers.
We make sure we put them at opposite ends so we don't get confused. On behalf of Tawnytown Police Chief Bill Tyler is Sergeant Brian Justice. Another big partner for us and even a lot of the outreach, Captain Eric Imler from McDaniel College. We also have that came up, which is, again, a lot of what we do is not only from a local enforcement, but also from federal, and we're lucky to have a very good partner in the U.S. Attorney's Office, Assistant U.S. Attorney Carrie Borzilleri. Did I get it close? I always get her last name wrong. If you're thinking in Italian, I shouldn't. I want to tell you a little bit about some of the things we've done there that we can be really proud of. I mean, there's obviously the partnerships with interdiction efforts that we've made, try to cut down the supply side of what we have with the drug problem. That's a very important component of what we do. And that is the partnership that you see up on the stage, but it's a very real thing. I will tell you, we meet very regularly. We talk about what's going on in the county. We talk about enforcement issues. We became part of the high-intensity drug trafficking area, which was a designation that we received earlier this year. All of that ties into us being able to cut down the supply. I also want to recognize some of our delegates. We have Delegate Haven Shoemaker, and Delegate Susan Krebs. And again, they are tremendous partners for us in Annapolis. When it comes to the laws that we need to change in order to be able to deal with the challenges that we have, as well as the fact of developing treatment options. You might have heard of the Justice Reinvestment Act. That was one of the components of the Hogan administration that they were very helpful in getting passed that will hopefully lead to more availability for treatment, which is certainly something that we need. I also want to recognize our commissioners that are present. We have Commissioner Steve Wantz, President of the County Commissioners, Commissioner Richard Weaver, and Commissioner Dennis Frazier. Again, another really integral part, not only the funding that the Sheriff and I had requested when we first came into office. That funding was critical for us to try to start addressing this issue more head on. Not only from an enforcement standpoint, but those of you that know the support they gave not only for funding of Tim Weber, so that we became the first state's attorney's office with a drug treatment education liaison embedded in our office, to really help deal with people that need that recovery, as well as their support and funding that helped us do the program, which we're going to talk about later, which is our special ops program, where we were able to go around to all the high schools and really get back in the high schools and present some really strong and direct information about where drug addiction leads. So their support has certainly been incredibly important. I also want to recognize our mayors. We have Mayor Perry Jones from Union Bridge. Mayor Kevin Utz was here earlier but had to go to another education every 15 minutes. He was going to speak there, but he was here earlier from Westminster, so thank you. Mayor Jim McCarran was here earlier in the day and was here throughout the day from Tawnytown. I certainly appreciate that. Mayor Neil Root from New Windsor. Mayor Ian Shaw from Sykesville, as well as Tawnytown Council member Diane Jackson. Foster, I meant. You know, you would think I'd know that by now. I really thank them. Our partnerships with the local government in each of these jurisdictions is huge. I mean, many of them have taken their own initiative and done different education programs, as well as working with not only from the law enforcement side, but from the county government side to help get this information out. Having recognized everyone, and again, a lot of what we have, I do want to also recognize all the people here today. This expo while the chamber is incredibly supportive and funds what we do and really helps organize this, the Expo really is only beneficial by all the people that come out today, many of you that are sitting in this room. And it really is a testament when I talk to people from elsewhere, it really is a testament to how well we incorporate together and how well we work together. And that really is what makes this county really stand out. When you walk around and I see all the booths and I talk to the people and what everybody individually is doing, from the health department to the hospital to our sober homes. Now, I do have to say the thing that scared me was the wheel of STDs. That scared me a little bit. But again, what you see is a community that is there and together. One of the things I have to thank too is the Hogan administration that has been extremely supportive of us and extremely supportive of the things that we're doing.
Good evening, everybody. It's a pleasure to be here in Carroll County. And Brian, thank you so much for inviting the governor to be here. We very much appreciate it. On behalf of the Governor's Office of Crime Control and Prevention, my name is Chris Shank. I'm the Deputy Chief of Staff with Governor Hogan. As already introduced, Kara Sullivan, the Chief of Policy, and Jim Hedrick out here, Governor Hogan's, one of Governor Hogan's advisors on substance abuse issues. It's very much a pleasure to be here and engage about the important work of education around these issues involving drugs and violent crime. We very much appreciate, and I was here last year and was so impressed that wherever I go around the state, I mention what a wonderful event this is here in Carroll County in terms of bringing law enforcement, the business community, the education community together to talk about this very important issue. Because when you look at these issues of trying to prevent our youth from getting engaged in drugs, you have to approach it from an enforcement perspective, from a treatment perspective, but then also from an education perspective. And that's exactly what you all are doing here in Carroll County. As Brian said, Governor Hogan was very pleased to support the Justice Reinvestment Act, which attempts to do all three of those, to give law enforcement the tools that they need to put drug traffickers behind bars where they need to be, but also at the same time to recognize that treatment is a very important component to all of this. And I just applaud the leadership here in Carroll County in terms of your law enforcement, your county commissioners, your delegation, for all recognizing what an important program this is. Governor Hogan wishes he could be here this evening but was not able to join us. But when he crisscrossed the state as he was campaigning for governor, he asked Marylanders what their biggest concerns were. The economy, taxes, all of them were very important, but the heroin crisis was really topping the list. And from our smallest town to our largest urban areas, heroin has indeed become an epidemic. As we hear about the stories from families and friends who are hurt from the devastation that heroin has wreaked on our communities. So we're making a great start. All the work that has been done and continues to be done by this community. Our administration has worked to expand residential treatment facilities by providing additional resources in the budget. A dozen medication-assisted treatment programs for those who are released from local jails to try to provide them with the treatment that they need. And in addition to that, the Narcan programs that I know that you all in law enforcement are supporting as well. So we're very much committed to working with our local and federal partners on this, and that's why we're very happy to be here today. And again, Governor Hogan supports your efforts and applauds the leadership of everyone that is involved in this event. So Brian, thank you so much for the invitation. Thank you. Thank you.